Here we'll talk about spinal cord pathologies. Begin by looking at some etiologies. Trauma itself taking place, resulting in spinal cord injury. What about an extraspinal mass? What if there was a metastasis that was taking place to the bone? Maybe from the breast to the vertebrae, maybe from the prostate to the vertebrae, and therefore causing injury to the spinal cord. Abscesses or hemorrhage even. Extraspinal masses therefore causing spinal cord injury. Or intraspinal masses, such as a hematoma, or maybe perhaps even a tumor itself, intraspinal. Other causes, inflammation, referred to as being transverse myelitis. And of course, you're quite familiar with the term myelo. Nutritional deficiencies, such as B12 deficiency. We looked at this with megaloblastic anemia, resulting in what kind of issue? The neurologic deficit called subacute combined degeneration, right? And I have ataxia due to spinocerebellar issues. I close my eyes and I positive Romberg sign because I have damage to dorsal column, so on and so forth. Infection, such as tertiary syphilis, may result in, once again, damage to the dorsal column. We call this tabes dorsalis. Vascular, strokes, possibility, and AV malformations. What if there was a spinal cord transection? What are the signs and symptoms that you can expect? Upper motor neuron signs below the level of lesion. What's that mean to you? Spastic paralysis and increased reflexes. Upper motor below the level of the transection. Complete sensory loss below the level because you can't make it up, right? So therefore you have sensory loss below the level. Pay attention to the section and where it's taking place. Bowel and bladder dysfunction. Look for incontinence. It may see lower motor neuron signs at the level of the lesion. Is that clear? So at the level of the lesion, lower motor neuron. What does that mean? Flaccid paralysis. Spastic paralysis below the level of the lesion. A particular hemisection of the cord is called Brown-Séquard syndrome. Let's take a look at the cause, such as trauma would be the most common cause. Rarely cord compression or partial transverse myelitis, referring to inflammation. Most common cause, trauma. So with the hemisection that's taking place of the cord, what are my signs and symptoms? I'm going to walk you through this carefully and very, very deliberately. Ipsilateral, so think about the spinal cord where one half of it has been lesion. Ipsilateral weakness, joint position, and sensory loss. You've talked about some of this with neuroanatomy. I just want to make sure that we're reinforcing it here. Contralateral, pain and temperature loss. Think about the spinothalamic tract and as to how it crosses over the central region of the spinal cord and makes its way up on the contralateral side. So therefore, if there was a hemisection, you can expect there to be contralateral loss of pain and temperature. And here once again, bowel and bladder dysfunction would be rare. Could occur, but rare. Our topic quickly here is central cord syndrome. Where are we? In the central portion of spinal cord. Picture that for me. Tumor. It would be a good idea at this point to make sure that you have a full understanding of the anatomy of the spinal cord so that you can we can walk through this together. There's something called syringomyelia. Where is my lesion right now? My topic is spinal cord pathology, specifically central cord syndrome. With syringomyelia, what can you expect? It's fluid-filled cavity within the spinal cord. Where? Right smack dab in the middle. Most commonly occurs in the cervical cord. So think about where you are now, okay? Because this is important. Now we're going to eventually get into our signs and symptoms, and you've heard of cape-like issues. What does cape-like mean? Think of Superman, and he wears a cape, or Batman, whatever, but a cape. And where does a cape then drape you? Oh, yes, over the shoulders, right? So cervical region. And we'll talk about cape-like lesions in a second. But understand as to what that means. Don't just memorize cape. That makes no sense. That will tell you where lesions taking place. Can occur after trauma, can occur in conjunction with Chiari malformation. Chiari. What does that mean? Arnold Chiari, not Bud. Are we okay here? Bud Chiari, has nothing to do with the spinal cord, huh? Has nothing to do with CNS pathology. Bud Chiari was hepatic vein thrombosis. Keep that separate. Another topic for another day. Here it's Arnold Chiari. Arnold Chiari means small posterior fossa. You have type 1 and type 2 Arnold Chiaris. And with Arnold Chiari type 1, you could have syringomyelia. Signs and symptoms. So where are we? Good. Central portion of the spinal cord. I told you about CAPE. What does that mean? We'll see in a second now. Loss of pain and temperature and CAPE-like distribution. Does that make sense to you? So where are you? Over the shoulders and you're draping down. Next, lower motor neuron signs in the arms. Upper motor neuron in the lower extremities. Is that understood? Your neuroanatomy has to be strong so that I can walk you quickly through the signs and symptoms in neuropathology. Generally spares the dorsal column. Why? Because this is the central portion of your canal, of your spinal cord. Clear. Your dorsal column is usually spared. Where did we see damage to this earlier? Subacute combined degeneration, B12 deficiency, number 1. Number 2, maybe something like your tabes dorsalis, secondary to tertiary syphilis.